Welcome to our review of the topic of blood-borne pathogens. If necessary, please adjust the volume. First, OSHA has established a general industry standard covering the safety issues surrounding blood-borne pathogens. Although the risk of exposure is highest to those working in the healthcare industry, potential exposure can occur in any setting where an individual can come in contact with blood. According to OSHA, an estimated 5.6 million healthcare workers are at risk of exposure to blood-borne pathogens such as HIV and hepatitis B. The purpose of safety training is simply to provide a safe working condition that protects employees from being exposed to health hazards that are related to blood-borne pathogens. Let's start with the hepatitis B virus. This is an inflammation of the liver and remains the major infectious blood-borne hazard an employee will face while on the job. Another serious pathogen is the well-publicized human immunodeficiency virus, known more commonly simply as HIV or AIDS. Till recently considered a death sentence to those who contracted it, it destroys the individual's immune system. Here is a kind of laundry list of those occupations most at risk to exposure. This doesn't mean that those in other fields should be left unaware of the hazards connected to blood-borne pathogens. In any situation where an individual is exposed to another's blood, we have a risk we need to be made aware of. Where the body is concerned, blood is in some ways everywhere. It's found in a number of body discharges, including vomit, urine, and feces. Let's consider some modes of transmission. HIV and HBV and other pathogens may be present in body fluids such as saliva, semen, vaginal secretions, cerebral spinal fluids, synovial pleural fluids, peritoneal fluids, and pericardial fluids, as well as amniotic fluids. Saliva and blood contact in dental procedures can occur. Unfixed tissue or organs other than intact skin from living or dead humans may also be an exposure route. Continuing modes of transmission. One can be exposed through accidental injuries caused by contaminated needles and other sharp medical instruments, contact with open cuts, nicks, and abrasions, as well as contact with mucous membranes of the mouth, nose, and ears are all pathways for transmission. Focusing on HIV or AIDS, this virus is most often transmitted through sexual contact, but may also be transmitted through contact with blood and some body fluids. HIV is not transmitted by touching, feeding, or working around patients or people who carry the disease. Here's a list of methods of HIV transmission: sexual contact with infected partners, sharing infected needles, cutting yourself with infected objects, getting infected blood in open sores, or getting blood in your mouth, nose, or eyes. Who has HIV or HBV? All types of people have the viruses. 300,000 people are infected with HBV annually. 35,000 are infected with HIV. A person infected with HIV may carry the virus without developing symptoms. They will eventually develop AIDS, and they may develop AIDS-related illnesses, including neurological problems, cancer, and other opportunistic infections. If you become infected with HBV, you may feel like you have the flu. You may be sick enough to be hospitalized. Your saliva and other bodily fluids may become infectious. Let's discuss control of blood-borne pathogens. This will be accomplished through employee work practices, personal protective equipment, housekeeping, and the hepatitis B vaccine. Training regarding HIV and HBV transmission shall contain engineering controls, administrative controls, personal protective equipment or PPE, and post-exposure evaluations as well as record keeping. There is one universal precaution. It's simply to treat all blood and body fluids as potentially infectious. Contaminated surfaces. Any surface can be contaminated. This can occur without offering any visible evidence. Most concerning is the simple fact that HPV can survive on surfaces at room temperatures for at least a week. Common kitchen areas pose an obvious hazard if a regimen of cleaning and disinfecting is not in place. Exposure prevention and control, especially for those in the healthcare arena, are to place sharp instruments in approved containers, wash hands after contamination, and do not keep food or drink on counters where infectious materials may be present. Let's look at safe housekeeping practices, especially for the healthcare worker. First, you should wear rubber gloves. Second, restrict the area of exposure to bloodborne pathogens. Third, use disposable towels for cleanup. And fourth, put contaminated blood in approved containers. A more immediate protective measure is donning of personal protective equipment. PPE includes gloves, masks, aprons, face shields, mouthpieces, gowns, eyewear, CPR pocket masks, and any other equipment which may reduce contact with skin or other potentially infectious materials. So let's always be prepared. Always wear gloves when at risk. Be alert for sharp objects. Do not pick up glass with your bare hands. And place sharps, any type of sharp instrument, in approved containers. Let's review common sense rules. Be sure to wash hands and remove protective clothing before eating, drinking, smoking, applying cosmetics, or handling contacts. In summary, although the day-to-day activities of a DeWind employee may not take them into activities or situations that would bring them in danger of making contact with a blood-borne pathogen, but when accidents occur, blood can be present. It therefore behooves each DeWind employee to be cognizant of this potential hazard and take appropriate steps to safeguard themselves and their fellow employees. This brings to a close our review of blood-borne pathogens. Now please take out the blood-borne pathogen exam. When completed, place it in the completed exam file. Thank you.